We will commence vaccinating the Medi Hotel and airport border quarantine personnel, as well as Central Adelaide and other local health network healthcare workers. Individual staff will receive an email with a notification that it's their turn to be vaccinated. In the email, there'll be information about the vaccine, as well as the prioritisation schedule and pre-screening questions. They'll complete the pre-screening questions, which will align them to a specific clinic dependent on their responses and their risk with the vaccination. There are 4 streams. The green stream and the yellow stream will come through the Royal Adelaide Hospital on level 5 into the regular clinic. In that clinic will be staff that don't have any contraindications to the vaccine or any concerns that will warrant a clinical review from an immunologist or a medical officer. There is a yellow stream, which is a nurse-led clinic for anyone that has any concerns such as fainting, needle phobia, that might need some counselling and some time and some privacy to talk about the vaccine. And then there are the 2 other streams. So one is that the individual is not suitable for a vaccine at this time. They will be referred to the adverse event clinic for consideration and discussion about the risks and concerns. There will also be an amber stream, which is in the same clinic at the adverse event clinic, where a medical officer and an immunology fellow will review the case and assess whether the individual is suitable for the vaccine. Healthcare workers will be receiving the Pfizer vaccine. At this stage, there is enough Pfizer vaccine to vaccinate the healthcare workers within SA Health. So the goal is to have them all vaccinated with the Pfizer vaccine. Should at a later date the AstraZeneca be available and more suitable to some areas, they will be vaccinated with that. No, it is not an indication that the Pfizer vaccine is better than the AstraZeneca. It's just due to availability that we'll be commencing the program with the Pfizer vaccine for healthcare workers. But that being said, there will be some services within health that receive the AstraZeneca vaccine due to logistics and stability of vaccine in transport. Currently, the vaccine is voluntary and not a mandatory requirement to work within SA Health. That does not mean that that will change in time, but at the moment it is a voluntary vaccination. At this stage, as it's a voluntary vaccine, it will not affect where staff are rostered to work within the organisation. So the end-to-end process is 30 minutes. The flow from checking in through to vaccine to post-observation should have you out the door within 30 to 35 minutes. When the pre-screening information is sent to staff, they will be given the option to select preferable times for vaccinating. We do suggest that you have your vaccine at the end of the shift or at the end of your roster in case you feel some normal expected symptoms following the vaccine. It is expected that there will be symptoms 24 to 48 hours following the vaccine. On arrival and prior to your appointment, you'll receive information that outlines the expected symptoms and then possible side effects. There is also information that if you are feeling really unwell or have concern about the side effects you've received, that you can contact a hotline for further information. You're also advised to attend your GP or, if there is extreme symptoms of concern, the emergency department. So when you receive your appointment and you're scheduling it in, please ensure that you're available 21 days following your initial dose. You need to have your second dose 21 days following your first vaccine. If you miss your second dose on the 21st day, we will need to undertake a clinical assessment to see if it's appropriate for you to have a second dose at the time that you are available, or whether you need to have a new course of vaccine. Within the Royal Adelaide COVID Vaccination Clinic, we have systems and processes in place to make sure that patients and staff are safe. We have a medical response process that, in the event that someone has an adverse reaction to the vaccine or has a significant side effect, staff are trained to respond and treat them appropriately.